everyone. Welcome to our Zoom party. We're just gonna allow a few minutes, but while we're doing that, you probably noticed there's a treatment that's happening behind me, and this is our lovely patient, Krista, who's getting two different treatments.
Hi, everybody.
There. So on the right, my right, is Lisa treating Krista with the Venus Freeze. Venus Freeze is one of our most popular treatments. This is radio frequency and magnetic energy. And so if you want no downtime, you want instant plumping, improvement in your pores, fine lines, if you have a special event, it's also great for facial shaping. And so that's what she's having on one side. And then Angela on the other side is doing one of our most popular treatments. Actually, I just posted this. If you're interested in me explaining, this is one of Paula Abdul's favorite treatments that we perform for her. It's our Rockstar treatment. And the Rockstar treatment is non-invasive as well, no downtime. And it works through plasma energy. And right now, there are millions of plasma particles that are being created on Krista's skin, and that creates instant resurfacing, instant tightening. Patients really feel like they look like they've had kind of like this nice lift, facial lift. You can use it for the neck, you can use it for the hands. Same thing with the Venus Freeze. So that's what's happening there. And I want to just welcome all of you guys who are joining us tonight. Thank you for coming in, spending time with us. I'm Dr. Tess Mauricio. For those of you who haven't visited any of our M Beauty clinics, we have 3 locations. We are now in our San Diego Miramar office. We are at what we call our M Beauty Life Center. This is where we have conferences, we have teaching opportunities, and we do a lot of taping and Zoom parties here. And then downstairs is actually where we have our main clinic. And then we have a Beverly Hills office, and I'm there on certain Saturdays. Actually, this Saturday, I will be there. And we also have a Chula Vista East Lake office where I was earlier today. So was Lisa, so that's crazy. And also, for those of you who live in the Bay Area, we are having satellite clinics next Friday and Saturday. And the schedule is already basically, it's full, but we're adding Rick, my brother, our brother, who's our RN as well, will help me because the schedule got so full. So thank you for all your support, my Bay Area friends. Yes. And thank you to Nico. I'm going to just say shout out to Nico, who's running our tech there, and he's raising his hand. So I figured there's a question, comment.
Does the treatment have any sensation like heat or steam?
Okay, so let's ask Krista. Okay, Krista, what's the sensation like?
This feels warm.
It's the Venus Freeze.
Yeah, and it's actually really relaxing.
Yes.
Like my eyes are closed and like, oh, this is so nice.
It is one of the most relaxing treatments. And this also comes with a body applicator, and patients fall asleep all the time because it's so relaxing, yet we really are activating, increasing your lymphatics, blood flow. It's also creating collagen over time. That's the Venus Freeze.
So you had to repeat because I was kind of stay what was happening.
Right. And
and on the other side, definitely different sensation. This, I would say, similar to if you got your nail and kind of slowly gently scratched across your cheek. But I also, it's
a great way to put it.
Right.
Yeah,
I think
scratchy,
a little bit like lightly
warm,
scratching, a little warm, and there's like occasional zaps that you feel.
All right, thanks, Krista. But both are very, very tolerable. That's really the key to these procedures. Krista drove all the way from LA. So that's how much she loves us. I really love our patients. They really are the most amazing. And so I asked her to be our demo patient. She's seen me wearing the CO2 lift mask on Insta. And so she's like, what is that? And so
yeah. I want to look as good as she
oh,
does.
thank you. You know, I gotta say, technology really works, and we live in an amazing time. And here at M Beauty Clinic, we are so proud to help launch and introduce cutting edge medical technologies. The goal is always to really help us be empowered to look and feel our very best at any age. You know, we have all different ages here, right? I'm gonna be 50 in November. I'm proud of it. You guys are seeing me up close. Yeah, you know, and really age is really just a number now. You have in your power the ability to age as gracefully, as powerfully as you can and you want to. And today we're going to cover not just rejuvenation of the face, the neck, the body, but something very, very important, but always, you know, last thing people talk about, and a lot of women are suffering from issues, and that's vaginal health. And so we're going to absolutely talk about, we're not going to demo that.
Sorry to disappoint all of you.
We have a model. We have a model right here. All right. Nico's been having his hand up.
Does it help with the neck and double chin?
Okay, so great question. And I just want to say that I want this to be as interactive as possible. Okay. So put your questions. Sometimes Nico will get my attention. And we have a very special guest as well, who is a wealth of knowledge, Alana Kerr, and I will introduce her in a moment. But is it good for the neck? So any of these treatments, you know, really where you have skin, wherever you have skin, wherever you have neck, the chest, the hands, the arms, even abdomen, like I said, the venous freeze, show them the body applicator. If you have cellulite on your thighs, if you have loose skin, you know, in your arms, in your thighs, abdomen, you want to tighten that. Spring and summer's coming. So this machine is getting very, very busy. Double chin. So this really is not the best treatment for double chin. There are other treatments that we offer, like Kybella, which is the injectable treatment that actually kills fat. And then also, obviously, we do liposculpture in the clinic as well. But you have just like a little bit that may help, but it's not really meant for fat reduction. We have other technology. So, all right. So I just want to welcome everyone. What do you think? Can start officially? Okay. I just want to welcome everyone. Thank you all for joining. I'm Dr. Tess Mauricio, founder and CEO of M Beauty Clinics. Here we're in San Diego and Beverly Hills and East Lake, Chula Vista. I am a cosmetic dermatologist, board certified dermatologist, known as America's favorite dermatologist. And I don't know why, just kidding. I also am a pioneer in regenerative medicine. A lot of the things we're going to talk about today is really activating our own body's unique ability to heal, repair, regenerate, and a huge advocate for women's health, women's intimate health specifically. These are topics that I lecture and teach other doctors from all over the world. And I'm so proud to be able to pioneer and expand all these amazing and introduce to the world these incredible technologies that truly are life-changing and will help us be empowered to age as well as we want to, no matter what age you are. So without further ado, I want to introduce an incredible lady. She's gorgeous, beautiful. So she practices what she preaches as well. Lana Kerr, she is the creator of CO2 Lift. And so she's going to tell us all about this incredible technology. So welcome, Lana.
Good evening, everyone. Thank you so much, Dr. Tess, for having me. It's going to be an exciting evening of information.
Yes, it is. And, you know, I think we have a lot of interest in, especially during the pandemic, right? A lot of people are not able to go in and see their doctors. I get a lot of questions from the media, from different platforms. What can we do at home to continue self-care, to take care of ourselves, our skin, our body, the vaginal health as well. And CO2 Lift, when it was presented to me, I'm like, oh my gosh, carboxy therapy, this makes sense. So please tell us a little bit about the technology and how you came to discover it, create it, and also all the wonderful things that it's doing for women all over the world.
Oh, I thank you so much for that kind introduction. Yes, the CO2 Lift is the brand. It's a brand of carboxy gel products, and carboxy therapy, guys, ladies, is a therapy that's very old. It's been over 85 years being done, but the only way to do it is to actually use an injection and the gas. So carboxy therapy is putting CO2 or carbon dioxide into the skin, and the body naturally will respond by producing a lot of oxygen. And it's going to actually rush oxygen-rich blood to the area that is applied. With the carboxy gel, the delivery system it forms a mask on whatever area you apply it for. So it's pain-free, it's effective, and you're going to get immediate results. But certainly it has an exponential result. So the more you do carboxy therapy, is actually the better your skin will look and feel. And as Dr. Tess says, she's a big believer in regenerative medicine and allowing your body to heal itself. And this is one of the modalities that does it very effectively, because you see, what you're depending on is your body's response to carbon dioxide. And universally, what will happen is just what I explained. When you input carbon dioxide into the skin, the body's going to rush oxygen-rich blood. So we have it for the face, we have it for the body, and we have it for vaginal regeneration, which is really my passion as well. I feel like I'm talking and talking, Dr. Tess. Tell me, how should I break it up? Should I just continue? What do you want me to say?
No, I think so. What we want to do, so those of you who are joining us, thank you, Lana. That's the gorgeous Lana Kerr, creator of CO2 Lift. And we will be kind of talking both together. We want this to be interactive. We just finished the Venus Freeze radio frequency magnetic energy treatment on Krista. And we also finished the Rockstar. They can be combined on the same day because there's no downtime. One of the things that we really are excited about the CO2 Lift is that it can be combined. And I really, if you are thinking about these procedures and coming into M Beauty Clinic to have any of these procedures, we really urge you to add it on. Yesterday, for example, we had my patient who's 79 years old, Lana. She's really an inspiration. Wow. She's 79 years old. She came in and, actually, she told me I've known her since before even my son was born. So 60, maybe 15, 16 years ago, she's been my patient. She said, I've kept her looking great. So there is benefit to doing treatments over time. You can really slow down, if not reverse the aging, and keep yourself looking great. So she came in, she heard about the Rockstar treatment, and so she had it done. She loved it. And then I told her that, we have now the CO2 Lift. So we added that on immediately after, and that's what we're going to do for Krista. And she loved it. It's soothing, it's cooling, and absolutely like what Lana said, that what it's supposed to do is even optimize the result from your Rockstar treatment or Venus Freeze or microneedling treatments, because it will increase oxygen production, it will increase blood flow, and all of that really optimizes healing, repair, and regeneration. So we're truly thrilled, and she was so thrilled, and the whole process was relaxing. And we'll show you, we need to apply the mask now because it takes about 35 minutes or so before it really dries. So, okay, Lisa's gonna demonstrate this. I'm gonna go.
So as she's doing it, do you mind if I talk?
Yes, no, go ahead,
okay.
Lana, please.
So what you're going to notice that she has two packets. Right now she has a large packet, and it's a gel. It's a pinkish gel that is going inside of that inside of the cup there, as you can see there. It smells very fresh on the skin, but she's going to put that in to the bowl. And then she's going to, once she puts that in, now just so you know, guys, the CO2 lift that Dr. Tess carries is a CO2 Lift Pro. That's a professional product that she has that, okay. And then we have the small packet, and I'll go back to that. So the small packet, you see what Lisa's doing? It's very important that when you get yours from Dr. Tess, you squeeze it up, because it really needs to be soft. And sometimes, depending on the temperature in the room, it will get harder. So she did a perfect job in squeezing it up. And now you can see it's soft and it's going in. And the important thing is to make sure everything comes out. So when she's doing it, Lisa, you're going to make sure everything came out, like even that clumps piece. Yes, it looks like perfect job. And then you just simply mix it like cake. And I love this part because I don't bake generally. So I get my baking, satisfaction by mixing that together, and I'm feeling like I'm accomplishing something. So you just
It really
mix
is quite
and mix.
satisfying.
It's
And
very
it does smell really fresh, refreshing. It's like you can't wait to put it on.
Yes, exactly. And you just whip it, you whip it, you whip it, you whip it. And that's actually very important. Sorry.
And what's going on here is a chemical reaction, right, Juana?
So there's something called gluconolactone. The gluconolactone that's in that large pack is mixing with the water, or the water in the large pack is mixing with the gluconolactone in the small pack, which forms a mild acid, which then mixes back with the magnesium carbonate. And that is what forms CO2. So as soon as it forms, we have the patented formula. Gel holds the CO2 into the skin. So when she applies it to Krista, which she has to do immediately, it's going to start infusing the CO2 into the skin. And it's going to feel very cool on her face. Okay, so you're starting.
Okay, we're going to apply it. And the key is to apply it on a thick layer, a thick, even layer,
Yes.
right, Juana?
Yes, kind of like a base, like going back to the cake analogy, like you're putting on frosting on the cake. You're just putting it on. It's very important to put it on very quickly. And what you're going to see is that you notice she can put it right up onto the lash line, which I think is so important because age really shows right up onto the eyes, and very few things you can put up under the eyes. It's very cooling. Also right over the lid, the eyelid. And I think for myself, one of the keys, my parents, so I'm Jamaican, we have a lot of mixture, Indian, Asian, Black, obviously, inside of us. But one of the things, that fat eyelid is my grandmother had it and I hated it. And I have the tendency to have it. And I notice the CO2, by putting it above my eyelid, it actually holds it in and keeps it looking youthful. And Dr. Tess was saying that she's 50 this year. I mean, she looks incredible. I turned 50 in February, and even more so, I noticed after that age, but by the next morning I woke up, I thought my neck was showing a little bit of age. So I immediately put on a Carboxy and put it right up on my neck.
Right. No. Really, a lot of times, even with skincare products, we forget the neck. And so this is, I feel that way. Like my neck was way behind, or ahead again,
Yes.
as far as aging compared to my face, because I've always taken care of my face. Also, we forget to even put sunscreen on our neck. And so using this in combination with your Venus Freeze treatments, the Rockstar treatment, microneedling, platelet-rich plasma, all of the regenerative therapies that we have is really, really incredible. The other thing is we get a lot of questions about dark circles and under eye issues. And I know, upper eyelids, under eyes, that's also one of the first areas that can show age because the skin there is thinnest. And so this really can help remove toxins from the area, also help oxygenate it, and then combining it with our platelet-rich fibrin matrix treatments and other treatments that we have to help rejuvenate the hollow, dark circles, and crepey skin in the under eyes can really help. And you absolutely can have this done as well with Jeuveau. I know later on, after the mask comes off, we're also going to do a little bit of Jeuveau, which is a Botox alternative. We use a lot of, it's one of our favorites here at M Beauty Clinic, for lines between your brows, your forehead, around the eyes. So how is it feeling, Krista?
Oh, it's so cool and relaxing, and it's a really nice sensation, to be honest.
Right.
You know,
Like a
something
nice
I
cool
think
breeze.
too, masks, everyone, you know, especially today, we're really into masks. So I think this was just an ingenious use of a mask. Having a mask deliver the carbon dioxide into the skin. To have carboxy therapy done is one of the things that, you know, especially when you're doing the other treatments that Dr. Tess has in the office, the radio, any energy base, it's important to do something that's going to clean that out, because when you do energy, it has a way to, how would you simplify this, Dr. Tess, when you talk about degrading the extracellular matrix? How would you simplify
Sure.
that to your patients?
So yeah, so in order to really, you know, the fibroblasts are the cells that create collagen, and if you look at microscopically how you build new collagen, there's actually breakdown that happens first, and with that breakdown, any kind of cellular breakdown, there's debris, and so the immune system is activated and cleans it up, and then blood flow, oxygenation. All of those things are really involved in, you know, the healing process, and it's that normal, natural healing process that actually activates the fibroblast cells to create then the collagen. And that's how we see the results clinically in improvement in wrinkles, tightening, plumping, you know, improvement in crepiness and hollows. So it's really kind of breaking down and then building up. So people get it when it's in the concept of working out, right? Because you feel it,
Yes.
right?
Mhm.
So it's like, okay, you work out. Actually, I tell my patients that I am their skin personal trainer. And you know, actually, Tony Horton and Tony Horton's wife, Tony Horton of P90X, and his wife are my patients. And so so I say, you know, when we treat Tony and his wife, they totally get it. I'm like, I am your personal skin personal trainer, and they get it. We're gonna give you a little bit of, you know, pain. There's gonna be a little bit of you know, breaking down that happens, but that causes the cells to really work and repair itself.
So, so this could be a good way to, that's a great analogy. So like, for instance, when you work out a muscle and say you work on one muscle group and then you feel so sore, it's harder to even, so you decide that you're going to work it in 2 days, but it may still feel sore because of that lactic acid. Well, the CO2 is like cleaning out the lactic acid very quickly so that you can work out again. So it really works like a 1-2 punch. You can break down, and the carboxy is simply helping you to clean that up very quickly so that you can continue to build. That's what it's doing. So it's very important for pre-treating, after a procedure, and certainly doing it monthly is a great way to keep your skin healthy, you know.
Right. So Lana, tell us what type of regimen you know, do you recommend? Obviously, what we're gonna do here at MD Uni Clinic will be to you know, combine it with the treatments that we're doing, and obviously talk about, you know, doing treatments at home, because a lot of people follow us and they're not from California. They can't get to us. And they're always asking, Dr. Tess, what can I do? What do you recommend? And so this is really a wonderful type of medical treatment that you can do to enhance whatever skincare products you're doing. If you're doing, you know, your own personal derma rolling at home, if you're doing peels, you know, that are not, again, not medical grade peels, but just, you know, anything like that, lactic acid or enzymatic type of treatments. You can do the CO2 lift at home, and then you know, you really can help optimize the health and beauty of your skin.
Exactly. And certainly I would direct you guys to definitely getting the CO2 from Dr. Tess, because she's carrying what is called the CO2 Lift Pro, which
Yes.
is it's a level 2 carboxy. So the one that you would get from the website is a level 1. It's granted, it's still very good, but if you're able to get it from Dr. Tess, you're getting the best way.
There's different levels. There's obviously the medical grade level, the pro, And that's the one that Krista has on. I think she's asleep. She's so relaxed.
Oh my gosh, this is the most relaxing time of my week.
Right? And so when you order it from us here at M Beauty Clinic, if you come in and take advantage of the attendee only specials, which are incredible, you'll be blown away. You will be getting the CO2 Pro, Lift Pro,
Yes,
CO2 Lift.
exactly,
Yes.
exactly. Someone was
And
asking
you have a
about what, someone was asking what kind of results can you expect from this, from the CO2, the
Okay.
Carboxy. Well, one of the things I think is the biggest signs after doing a Carboxy is the hydration. You know, you don't get old, you dry up. That's one of my favorite sayings. You know, you think of that grape, and the difference between the grape and a raisin is simply that it has lost water. So a raisin is just a dehydrated grape. Well, from the time that we're born and by the time we're, I think, 22, 23, we start turning into a raisin. Fortunately, there are therapies that what Dr. Tess provides that's able to slow that down. We just want to slow it down and not get into the raisin state. So one of the biggest things Carboxy does, it increases hydration in the skin, and it's proven to increase it by over 117%. And that's very big. If you think about, if you took that raisin and just like shoot it with water, it's going to swell up, and that's kind of how your skin looks. And that's why if you had very aged skin that you weren't treating, you're going to see a dramatic improvement. But younger skin and skin that is healthy and looking like this patient here, she's going to see a glow in her skin. But she's going to, and that is going to keep her looking where she doesn't have to wear as much makeup. You know, she has healthier skin to work with other treatments that she's doing. So, but one of the biggest things you're going to see is definitely hydration. That over time, what I've noticed in myself is that I think when the time I turned, like maybe when I was maybe in my early 40s, I started getting pigmentation on my skin. And I've noticed by doing the Carboxy, it's able to help clear the pigmentation off my skin. So I have clearer skin. I can wear, you know, as a Jamaican, I hardly wear a lot of makeup. I really don't like it. And it allows me to still have that, you know, not have makeup, but makeup look on. And for those who do wear makeup, you can wear less and it will last longer. But it will keep your skin glowing and like a baby's bottom.
Right. And, you know, I have a lot of patients who have issues with, you know, eczema, dry skin. We have a lot of patients who come in with discoloration, melasma. And, you know, we do recommend certain products, but I really feel that this adds a lot. It really can add a lot. Because it can optimize the health of the tissue so that whatever we're doing, whether it's the time machine procedure that you're going to have done, whether it's the vampire facial that you're going to have done, you know, when we're working with healthier skin, your results will be better, your healing will be optimized. And so I'm really excited to see how the patients are going to really love their treatments even more. You know, we get, Lana, we're really lucky because we get amazing results with our treatments. But now, you know, my goal is always to try to push it, you know, try to get better and better, try to find newer and exciting innovations in trying to get our patients optimized. Yes,
Exactly. You mentioned something too. This month, I think, is National Rosacea Month. And so this is a treatment, the Carboxy, because it's getting rid of inflammation for those of your patients who have that very uncomfortable situation going on. This is a great way to do it. I know from my experience with like an acne inflammation flare up, maybe where was it? When was this? This was back in 2019. I had gone to a meeting with many dermatologists, and they tried a laser pen on me because it could go with Fitzpatrick 5 and up. And I was only darker skin in that small gathering. So as much as I don't like doing demos like this beautiful patient here, I did it to showcase the Carboxy healing quickly. However, during the process, whatever numbing cream they put, the energy drove it into my skin, and I developed like an acne-like look that was horrible. So it was a good looking back, because for me to experience how skin can affect your whole personality, because usually I'm very confident, and with my skin looking like that, I felt like I had to explain to everyone why my skin is looking. It just made me feel, it really gave me a greater appreciation for what dermatologists do for their patients, because it's a big part of how you feel confident as a woman. Anyway, they put me on steroids and they put me on some other antibiotics to get rid of it. And my dermatologist was saying, Lana, give it 4 to 6 weeks. And I'm like, are you mad?
I'm
I'm in
hiding.
skin. So another physician who uses it said, Lana, why are you freaking out? Use a Carboxy. Huh? Yes, use a use a Carboxy. And I did a series doctor test. So I did 5 for the week. So by the 7th day, my skin was completely rid of any inflammation. So it just was the silver lining in all of that was, first of all, appreciating dermatologists even better. But secondly, to see how the Carboxy can really help someone in a very quick, short period of time.
Well, you know, it's interesting that you're talking about this connection between mental health, confidence, self-esteem, and skin health. How I got into dermatology actually is through psychiatry. You know, when I was a medical student at Stanford, I thought I was going to be a psychiatrist because I truly cared and I wanted to improve my patients' mental health. But when I did a rotation in dermatology and saw the negative impact on self-esteem and confidence, you know, skin conditions like acne, eczema, psoriasis had on patients, and the ability that dermatologists have to help them clear their skin and transform their lives and transform the quality of life. And now you get a shy, withdrawn teenager who's covering their faces, not going out, to someone outgoing, going out on dates. And so I thought, wow, that was like a light bulb. And I said, this is dermatology is a way to actually impact positively the mental health of my patients. And I constantly talk about that. Actually, tomorrow morning, I'm doing a skin talk event for with Proactive. Okay. Because absolutely 40 million people suffer from acne. And I truly believe that the CO2 lift pro carboxy therapy would be great for inflammatory conditions like acne. And right now, so many people are suffering from maskne, irritation, dermatitis from their mask wearing. And so this is a good way to calm the skin, also optimizing the barrier function of the skin so that whatever treatment, whether you come to the clinic and you have a hydrofacial treatment for your acne, or if you have an acne laser treatment, or if you just, you know, we prescribe you some topical treatment, it allows the ingredients to penetrate the skin better, work how it's supposed to, instead of creating extra irritation and new problems for the patients. And so we absolutely will recommend this for all of our patients with inflammatory conditions like acne, like eczema, and also rosacea. And so that's the benefit, I think, of also going to a dermatologist, because not all breakouts and not all redness and rash is the same. Exactly. And so when you go to a dermatologist's office, we can really, you know, figure out what's going on, get to the root of the problem. And at M Beauty Clinic, we approach it medically, kind of the traditional medical approach, but obviously cutting edge approach so that you don't have to wait the 4, 6, 8 weeks yes. to get better. Because yes. every day you don't have great skin it's like a weight on your shoulders and your confidence level. You're not your best and you're not performing at your best.
Exactly. And too, I was thinking, even especially a lot of the acne medication dries out the skin. This is now a hydrator. So you're getting the benefit of the acne mm-hmm. medication without the downside of the dryness. You know, using even for using any of the even anti-aging products that kind of dry out your skin. This is a great way to counteract that and still get the benefit of what you're doing.
Right. And someone was asking earlier, what age should you start? You know, what I love about younger people now, Lana, is they're really informed. You know, like our generation, nobody, I mean, you almost felt guilty when you want to take care of your skin. You almost felt guilty when you're doing things to, you know, make you look your best. But now the younger people are into self-care. I was just in Clubhouse like twice last night about self-care. And I'm so happy because younger people are realizing that even in your 20s, in your early 20s, you already are losing collagen. Your hydration is not the same. You're not exfoliating as much as you were when you were younger. So you're going to start seeing discoloration, pigment issues, clogging of your pores. And so you can use this as a prejuvenation.
Yes,
You know,
I love that word too. And I love the fact that just as you said, younger people are taking advantage of the information out there and starting earlier. And I really wish I did that, because you can kind of freeze your skin. So you talk about generational dermatology starting from in your 20s to see how can you lock that in. I saw this presentation once, Dr. Tess, of a woman who they were twins. So one started at her dermatologist from she was 23, and the other one didn't start till she was in her late 40s. Suppose you see the twin that started in her 20s, she looks a good 20 years younger than her sister, all because she started seeing her dermatologist from she was in her 20s. So you can recommend what can we start. And certainly the Carboxy is a great way to, as a virgin, introduce you into the world of more aggressive procedures by doing a medical treatment that is so easy for your skin and feels good, no pain, and yet you're starting that journey onto just other things.
Absolutely. And we see families at M Beauty Clinic. M Beauty Clinic is a family affair. So I'm the oldest of 4 kids. We immigrated to the United States in 1984. And my brother and my sister, my brother Rick, my sister Angela, are both BSN RNs. And so, when you get a quote and it says RN, it's really one of my siblings, unless you're in Beverly Hills, and then it's Jerry, who's almost our sibling. And then our sister Cheryl helped run the entire, entity. So all of us work together. But, we definitely see generations, right? Moms like in their, in their 50s. I have a daughter now who's going to be 22 next week. And so she's really already starting. Also, one of the things that we talked about during the self-care session yesterday on Clubhouse is, teaching your kids and being a good role model for your kids, especially if you have a daughter, on how to take care of your skin. If you are taking care of your skin, your daughter is more likely to think that self-care is important. And I think, Lana, a lot of people, like a lot of women, feel guilty about spending money and doing treatments for themselves. But I always ask, if it was your daughter, would you want her to take care of her skin? Would you want her to live with pain? Because I know we're going to talk about vaginal health. Do you want her to live with pain, with incontinence, when she's only in her 40s, 50s, 30s? And so think about that. I mean, I always aspire to be a good role model for my daughter and for the younger generation out there, which is why, whatever extra time I have, I'm out in different platforms trying to really help get information out to try to empower the next generation.
I think that's amazing. I really, and as you said, it's really about empowering. You talked about your patient who came in who was 70. How old was she? 75?
Yeah. Oh,
okay, I'll wait for her to come back. Yes, your patient that came in. Okay, you're right. Your patient that came in that was in her 70s. What a wonderful thing if, first of all, we're living longer, right? We're taking care of ourselves. Why shouldn't we continue to look? The longevity should also be in our skin. So I really feel that spending more money on your skin and less on other things, because your skin, once you're wearing your skin, that's your best clothing, your skin.
I cannot get, people who are carrying $3,000, $2,000 purses and allowing their skin, their body. We only have one body, and we only get one chance. And so I feel, because it's so linked, skincare, skin health, is so linked with our mental health, psychological wellness. I truly believe that it's worth it. And the patient, I was going to say, the patient yesterday that we treated after her Rockstar with the CO2 Lift Pro, Lana, also has had vaginal treatments. She's had the O shot for, mild incontinence. Incontinence, for those of you, it's a medical term for when you're like jumping or you sneeze, you release a little bit of urine, or if you're laughing, you gotta, hold your pee. So that is so common in women. Pain, dryness, especially after menopause. Those who we get patients who've had breast cancer, and chemotherapy has really dried everything. And so we offer solutions for those. I've been doing these treatments, women's intimate health treatments, like the OSHA, which is platelet-rich plasma, injected in key areas to try to restore the tissue. So your growth factors, same thing. If you've had our time machine procedure, vampire facial, you understand that platelet-rich plasma holds incredible growth factors that can optimize the healing and health of any tissue that we injected, including, the vaginal area. And then we also combine it with energy-based devices, sort of like the time machine on the face, the neck. We have a combination procedure called the V time machine. And we have a video of this, right? So should we play it now? I guess let's play this, Lana, and feel free to comment. So this is our V time machine. And absolutely, we would recommend the V CO2 lift for any patient with these types of conditions.
Yes.
Okay. So this is one of my other dear friends, Patricia Javier. She's actually an actress, a beauty queen, and she actually flew in from the Philippines to have this procedure done about 3 years ago. And she was kind enough to have us videotape it. And there's the hand piece. There's a laser. We use it to basically rejuvenate the outside, the external part. And I'll show you in the model where we do this. And then we also treat the inside, the entire vaginal canal, to try to rejuvenate it.
Yeah, I think that's so important. I mean, and you talk about every age, because today women are under stress, and when they're under stress, it affects their natural lubrication. After you have a baby, to be able to have a woman, and some women don't necessarily, it's great when they do energy, but some women they want to try something first. This is a great way to get into more invasive procedures in the vaginal area. So we're talking about affecting the natural lubrication. We're talking about the aesthetic appearance. We're talking about orgasmic quality. Sensitivity is going to increase. Okay, so we're going to mix it and we'll show, but I'll tell you a little bit how.
This is our model. So when, when patients, not Krista, she's asleep. Krista, how are you feeling?
I'm so sleepy.
Yes, and this part, to the relaxation part, is healing as well. And so when you're doing these types of procedure, whether in the clinic or at home, just the time alone for you to close your eyes, just the time alone for you to take a pause, especially now, women, we're so busy, crazy busy. That's why I love masks, because it forces me to lie down. I can't walk around with it, as much. And then it forces you to close your eyes, and that alone is healing. And so this is the model.
Yes. Okay. What's her name?
Yes.
What's her name? What do you call her?
I don't know. She doesn't have a name.
Gina? You call her Gina?
Yeah. So if you come in and you're gonna have a treatment like the O shot, we explain, because this is the funny thing, is I don't think very many of us women don't even know how it looks down there.
Yes, exactly. I actually have a vagina puppet.
A mystery, And so essentially, this anatomy. So it's not like to scale or anything, but it's a good demonstration. So obviously there's the outside part, the labia majora, labia minora. And down here is what we call the introitus. If you've had an episiotomy, that's the part that they cut and then they sew back. And so there's a lot of sometimes potential issues there, like sensitivity, numbness, pain. The tissue changes, so you can also have a lot of skin breaks there. You can have some infection as well, recurrent infection. So going in, you can see inside and on the side. Okay, so here's your bladder. and the bladder connects to this tube area here. It ends in what's called the urethra. So the urethra is basically inside there. So that's where the urine comes out. So the bladder holds it and the urine comes out of the urethra. And up here is the clitoris. So the O shot essentially is an injection of your own PRP. We draw your blood, spin out the red blood cells, collect platelets rich in growth factors. That's injected if you have issues with incontinence, pain, dryness, and or if you just want to enhance your experience, we inject it around the urethra. If there's issue, if you've had an episiotomy around the introitus and then the labia, because it really can help the aesthetic appearance. It makes everything look better. I'm telling you, Lisa, come here, Lisa. She's had these procedures done. Ooh.
So unfortunately, I had a 8.5-pound baby who was stuck in my canal for over an hour. And yes, I had an episiotomy. I tore everything, the whole nine. Had this technology been around back then, would have been a lifesaver, because what I learned from Lana is that we can use this post-procedure to help heal that area.
Yeah.
All that discomfort post-healing, postpartum.
Yes,
And
those sits baths,
it would've been
Lisa. The sits
fantastic.
baths. You remember the
So-
sits baths?
I'm sorry?
Sits
The
back.
sits baths.
Oh,
yeah.
right.
Oh.
Yes,
Oh my gosh.
absolutely. And
Yeah.
completely uncomfortable. But knowing how this, I did try this also. They did the 5-pack. Now my issues are, I can't do the jump rope. I can't do jumping jacks. So, and I do pause before I sneeze. I
Mhm.
have had the V-Time machine. And now knowing that I can do this for maintenance
Yes.
is wonderful, because now I did do the whole 5-day treatment and I realized I don't have that urgency
Yes.
where I feel like, oh my gosh, I
Yes.
gotta run to the bathroom. So it's fantastic. And it's only been a couple of weeks and I hear it can only get better.
Oh, absolutely. With
Yes.
any of the regenerative procedures, most patients or many patients will experience instant improvement where you
Yes.
notice it. But that doesn't mean that that is the end of it.
No.
Just like if you're working out, you work out today, you don't expect to be, really big and buff, like even within a week. It takes time for collagen, for, proteins, for blood vessels, for nerves, and all of that to regenerate. And so it's not uncommon. Actually, I just saw a patient who I haven't seen for over 19 months because of the pandemic. We did the V-Time machine, the laser plus the PRP treatment on her. At 3-month follow-up, she's like, I'm not sure, because she had a lot of pain, a lot of dryness. I'm not sure if it's working, but she came in because after the pandemic, she finally got vaccinated and she came in for fillers and Jubot. And she's like, the V-Time machine worked like magic. And so it can really take time, but
Well, it's not painful. Someone
excellent.
was asking the CO2 Liv, I don't know if that was, but it's not painful at all. It's very cooling,
Okay.
very
I've
relaxing.
tried it as well. I've tried this as well. And, the concept of, applying a mask and we'll show this bed, Lisa, and mix it. And essentially go ahead and mix, and then we'll kind of show. So you mix the product and then you have a syringe that you draw.
That's the
Let me
tricky
show
part,
you how
Dr.
this is
Tess.
done, because it's not intuitive. Can you come a little closer?
Yeah, because that's the tricky part, Dr. Tess. As
Yeah,
she
this is
starts
the
mixing it,
trickiest.
I see a
That's
couple
why I'm like,
questions.
we need to demonstrate this.
I see a couple
Yeah.
questions here as she does that, Dr. Tess. What's the best age to start CO2 lift before you become like a raisin? I would say, certainly, put it this way. My son, my youngest, is 17. He's been doing the Carboxy on his face because his looks are very important to him. And he's 17 years old. He's been doing it from the time he was 15 years old.
And I mean, any age,
Yes.
it can be good for any age, because especially if you have inflammation,
Eczema.
especially
lot of
if you
young
have
patients.
acne.
Young patients, Dr. Tess, who have acne or who have eczema in different parts
Correct.
of their body, they can use it.
A little bit.
Okay, let's see. So you see what Lisa's doing? She mixed that big packet, the similar thing what you're doing for the face, but you're going to mix that together. And it's not as much. And it's what is the key to this? You see how that white clump in there? Definitely when you're mixing the two, it's very, very important to mix it totally so
Okay,
it's
all
smooth.
right, and show
So
them this.
what I found is if I
Bunching
push
it.
all of it into a corner,
Yes.
because it can be tricky getting
Yes.
it into the syringe.
Yes.
You want to kind of air the syringe out a little bit and then push it all into one corner and then
Yes.
try to,
You can do it. Yeah.
you can do
It
it
looks like
Yeah.
really it's gonna do it.
and just follow it
And see?
along so you can get as much as you can. And up, no, I'm not successful because I'm trying to do it while looking at the camera to see that I'm doing it correctly, but
yeah, that's good. So you just do a little bit just so we can do a demo. You don't need to do a lot. Yeah, so yeah.
okay, I'm
And
not gonna
then-
go all the way, but you can see that I've got a good amount of it inside, but I can get up to about halfway.
Mhm.
And then we're going to,
So essentially, those of you who wear tampons, it's like the width of this is like a tampon. So it's not gonna hurt. It's not gonna be scary, and you really just go and insert it in the vaginal canal. It
Mhm.
should be very smooth. It should be easy. If you have a lot of dryness, then this, the consistency of this can even act almost like a lubricant.
Right.
So even if you're very dry, it shouldn't be an issue. But if you're normal, it really should not be a big deal. And you just kind of squish it in there,
Mhm.
and then
you
Yeah,
want
and
to
the
take at least 2 to 3 attempts to get as much as you can in there.
and then you absolutely want to apply it on the
The
external.
vulva.
Yeah.
At the end, you can either use the stick to apply to the
Mhm.
external areas, or you can actually use your fingers, whichever is easier.
And yeah, and some even, all the way the skin
Perineum.
here, all the way down. And so any area, any tissue that gets the carboxy therapy really will be optimized. And so, okay, all right. So I think we'll
Dr.
take,
Tess,
we'll
Dr.
take
Tess, can I
questions.
say
Go ahead,
something
hon.
real quick? Dr. Tess, on that,
Absolutely.
when they put it on, it's best to do that at night. So do it at night
Correct.
when you just put it, and then you can just put a pad on, and then you just go to sleep. And then you wake up in the morning, when you pee, it will plop out into the toilet, and then you just rinse the rest out with the
Right.
with
So
the
you use
thing.
this, and then you just put a little bit of water, and then it comes out, and it's very safe. So mention something about the safety
Yes.
of carboxy therapy and CO2 VCO2 lift for the vaginal area.
It's a benign product. It has no contraindications. I mean, you're talking about you can use a carboxy on an open wound to close a wound. So you are not going to, there's no sensitivity. You don't have to worry about, oh, is it going to hurt? It doesn't sting. Inside the vagina, it's very cooling and very relaxing. And it's a minimum time of 45 minutes. But I usually just do it at night after I finish, spending time with my husband. I go ahead, push it in, put on a pad, go to sleep, wake up in the morning, and it's just it's as good as new.
Yeah, I love it. I love it. And so it comes in a pack of 5. And so the recommendation is you do it either every night or every other night.
Yes.
And then you do a series of 5. And then after that, you do it monthly. So think of it like skincare for the vaginal area. We've really never had this. It's sort of like a cool new concept. We get that our face, our neck needs daily maintenance skincare. But for the vaginal area, patients will come in, they'll get their PRP injections, the O shot, the laser treatment, and usually we don't see them, for a while. And so we're all going to contact, if you've had those treatments out, we're going to contact you and really educate you that you can do this at home, and your results will end up most likely lasting you longer.
Yeah.
And then for those who are not ready to have the bigger procedures, especially younger patients, and you just want to optimize the health there, if you've had vaginal childbirth, to restore. How quickly after vaginal childbirth the OBGYN usually recommend?
Right away. They're doing it. So when you go home, you know how usually when you have a vaginal birth, you may have on a pad, So you may not want to put something up there, but putting the gel on the outside and even a little bit on the inside, you can do it the next day and then put your pad back on. And so you're actually regenerating that area quickly so that you can get back to yourself, snap back. And it's not only the inside, the functionality, but the outside, it will reduce inflammation, and usually it's swollen. It will come
Yes.
back down, and you'll go back to yourself. So right away you can use it.
Yes, and I really just want to stress on, I know you're passionate about this too, the importance of sexual health.
Oh, gosh, yes.
Importance of that in our well-being, our mood. I mean, I'm telling you, we have patients who've had treatments and they're crying because of happiness. They're enjoying their lives. They're having good relationship, the closeness, the intimacy that they've lost. Yesterday in Clubhouse, one of the attendees actually shared that, because I was talking about vaginal health and sexual health. And she's like, it's so sad that her parents ended up divorcing because her mom just didn't want to have sex anymore because it hurt so much.
Yeah.
And
it's
so
very common.
I've had patients where they haven't, had relations for years with their husband. I'm like, how does that work? How does that not affect your mental, psychological well-being and your relationship? So please don't ignore this area. And
someone was just making a comment, Dr.
Okay.
Tess, that dryness and pain, you're going back over, has been an issue. This is something you definitely want to get from Dr. Tess. Okay, they're doing the peel off. This is my favorite part.
yes.
Now,
Okay,
Lisa, you don't like using the stick to peel off? I mean, I'm not gonna. You can do it. You can do it anyway. I like the stick.
I've tried both ways, and I feel like sometimes with the glove, because it's sticky, it kind of helps lift. So you can use either the stick, or you can use your gloves. If you have the gloves, it kind of helps adhere to it and lift it off.
Okay.
So if you can kind of come close,
Yeah, just go close so you can see.
you can see how it comes off. So I applied a little bit of a thinner layer on the neck because it really is more for the face. But you can see how it comes off right there.
Oh, and look at how beautiful Krista's skin is. You can kind of see there's a difference between her chest skin and her neck skin, the treated area, because it's less red.
Look how beautiful
It
that
looks
is.
like it's less, there's less inflammation, redness as well. So I'm gonna have Krista look.
Lisa, you're doing such a great job in taking it off. My mouth is watering.
Thank you.
Lisa's a pro.
It's
She's
watering.
good at everything.
Oh gosh, no.
Yes. Okay, Krista, wake up.
So nice.
Wake up, because I'm going to ask you to speak soon.
You know what, too, I find,
I know.
Dr. Tess, because I have seen so many controversial talks about when people do things at home, like a derma roller, right? Because some dermatologists will, it tears the skin. So if you're doing a derma roller treatment, definitely get the CO2 lift Carboxy from Dr. Tess, because even if you did something wrong, it's going to heal it right away. So it's going to take away any negatives that could happen if you made a mistake on yourself. So
And that's really an excellent point. Normally, I try to get people to stay away from do it yourself stuff, because there's a lot of misinformation on the internet. You go on TikTok and you're like, oh, all these like fads and crazy things that end up hurting people. We actually have had people who've done their own chemical peels at home, and they burn themselves, and we have to actually do a lot of treatments now to repair the skin. But I feel really comfortable, recommending the CO2 lift, because scientifically, the biochemistry and the chemical things that are happening here is really, really safe. And it can only enhance your skin, but peels, at-home peels, I'd be very, very careful. Don't buy any peels from online and apply it on your skin. Derma roller, again, depending on what you're doing and how you're doing it, how deep you're doing it, you really can injure the skin. Or at-home laser devices, you want to make sure that you follow instructions. There's only certain skin types that those are good for as well. And those with skin of color, like me and Lana, we have to be very careful when you use intense pulse light or laser at home, not under the guidance of your doctor, because you can get into trouble. And we've seen patients get into trouble. So we've removed the mask now. And those of you who are still with us, thank you for joining us. I'm looking at on my watch. It's like, oh my God, is it already really 6:30? Lana,
I know.
time flies when we're having fun.
I know you're so. This has
Okay,
been fun.
take a look, Krista. Oh, and I have still a little bit left. Yeah, so we'll have Krista wash her face after, and then we'll put products on. So this is also a good time to put your products, because your skin barrier function, like I said, is intact, it's healthier, and it's more likely to really absorb it, react how your skin's going to react how it normally would, especially if you have chronic conditions like eczema, acne, and all of that. So what do you think, Krista?
It feels like, I guess, like imagine a snake feeling skin. Like it just feels like you have fresher, newer skin. And
Krista, doesn't it feel like
tighter?
Yes,
tighter and really dewy.
The hydration.
Yeah, like I just feel like, I feel yummy.
Gorgeous.
I feel yummy.
You feel yummy.
Yeah, it's a really nice feeling. I mean, I guess it's what we're chasing when we put moisturizers and we spray toners and things, is we're looking to feel refreshed. But I feel like that feeling goes away pretty soon after we apply, unless it's a night cream that's thick that we don't necessarily want to walk with every day, especially meeting with people. And this feels like it's kind of put into my skin. And it's coming from the inside, not just layered on top. And feeling filmy. It feels
oh my
like
God, this is so good.
Moisture from the inside.
I love her description.
If it's coming out,
you were so good at that description.
Perfect. I'm half asleep.
We have just top people that you know we deal with and love us, and we hang out with. That's why I love what I do. We have incredibly just incredible women.
Hey,
good.
Yeah,
look at your neck. I really see a difference between your neck and chest, actually.
Actually, even when I touch it, this feels a lot more dry and rough, and this feels really smooth. And you can see my sunspots because I've been getting sun recently.
Dr. Tess.
It feels so much smoother and softer and moisturized compared to my chest.
Yes.
I actually want to, can we put some here too?
You know, Dr. Tess, that's a great thing. For people who can afford to, the décolletage is a nice place to put it too. You know?
Yeah, no, I actually put some on my hands. The post that I did with CO2 lift. It's okay,
Next
just
time.
try it. Fine.
Or
It's
whatever.
perfect. So I actually treated my hands. Hands, as you know, Lana, shows age, and again, one neglected area. And it's something that we see ourselves. Like, you know, you look, and then a lot of my patients, they don't want to wear their jewelry. They feel very self-conscious about their hands. You can apply this as well. And if you have discoloration, laxity, if you hate the way the tendons look, we have treatments in the clinic. And then this, obviously, you can do at home. We can help you, teach you how it's done.
So ideally, someone will want to do a series of 3 to 5, depending on where they're starting. And then if they can do it at least once a month, I mean, I do it every 2 weeks because I need to make sure that my skin looks the best. And I just don't want to look old. I want to delay it or look, as best as I can as I get older. So doing a Carboxy at least once a month, but certainly every 2 weeks is a great thing to keep that skin looking great until you come in to see your dermatologist.
You look amazing. You already look amazing. So this is really Krista's a prime example of prejuvenation, and so Krista's been coming into the clinic for how many years now, Krista?
Almost 5 years.
Almost 5 years. And we've done we would do the Venus Freeze treatment. She's had the rock star. She has a little bit of Jubot for her forehead, around the eyes, and she does skincare, and so she's really excited to try this. And I think this will really go a long way for younger people who, really just don't want to deteriorate.
This treatment helps regardless of what age. And I think Dr. Tess was really, and I'm really a big proponent of starting early so that it's easier to maintain than to reverse. It's easier to maintain than to reverse. So you want to start and not wait till you're older, then you're like, oh my goodness. Because one of the things that's so interesting when you're in your 20s and you look at your skin through a magnifying glass, you can see the lines starting. So those lines.
I'm a big believer and practicer of this early care.
Yes.
I started young, 19, but I didn't have as good as care as I do now in the past 5 years with Dr. Tess. And I'll tell you, I look back from photos 11 years ago. Gosh, in 2010, I can't believe it's that long ago because I still look I don't feel like I just look the same. I actually look at photographs and go, wow, I like how I look better now.
Yeah.
I wouldn't want to go back and be that.
Same.
Like I like this right here. And I think when you have really good care, then you get to have the looks and the feel of young skin, but you get the wisdom of your age with it. It's I mean, come on. That's
Amen.
next level living for
That's
me.
empowerment.
Yes.
No,
So
it's
true.
really true. Krista, what you're saying is absolutely right. I started taking, I've always been vain. I hate that word, right? I've always been vain. It's not, it's really self-care. It's really respecting yourself. And, if you truly believe that, this is our temple, right? God gifted us with only one body. It really is a responsibility for us to take care of it as best as possible, however we can do that. And so that's always been, I've started doing, things for my skin, even in residency. So that's like about 25 years ago. And I really found that my skin has gotten better. I was just in Vegas. My husband and I celebrated our 23rd wedding anniversary. You want to just say hello here, babe? Make an appearance. You'll see how youthful this almost 50-year-old guy looks here.
Yeah.
He doesn't have a choice. I treat him. Okay, say hello. So
There
he is.
Oh my goodness! Yes.
Lana, there's my husband.
Oh, so nice to meet you.
Oh, it's very nice to meet you as well. You're a powerhouse, female. Like I married one. It's kind of intimidating at first, but you later on.
Well, you look incredible.
I mean, men know how
you
to
look
enjoy,
incredible.
Powerhouse women. But yeah, so we were classmates at Stanford Med School. We got married there. We had our daughter just a couple of months before graduating from med school. And James will vouch, and our medical school classmates will vouch. I look much better now.
Oh yeah, that's if we were allowed to show her before and after pictures, we would never rest. But yeah, no, I actually was able to take our daughter when we got our medical school diploma. So that just thank you for that memory.
Yeah.
Well, anyway,
I love them so much.
Oh my God, what an adorable! Oh my God.
We also, one of the things we also offer, and I just saw this on your Insta story, Lana, is hair restoration.
Yes.
And optimizing the health of our hair follicles, right?
Yes.
And we do a lot of hair restoration treatment.
Yes.
Krista, young, beautiful Krista. Talk about what we've done actually, because this is happening to young people. Hair loss, hair shedding, especially from the pandemic stress.
Yeah, I was a swimmer before, so I think my hair did get weaker from chlorine. I was also a dancer, and they were constantly pulling my hair back for shows in really tight buns and doing modeling and things, and the different hairstyles that they would do. I think I slowly started to break my hair down. I experienced the half of my hair falling out after a treatment that a TV network in the Philippines had me do to straighten it. At Friday, they were curling my hair, doing different looks, and my hair was just falling out, and it grew back a little bit. And then I went through a very stressful period, and I noticed that my hair started coming out right here at the top. It was thinning, and I actually started avoiding putting my hair in a ponytail because I was embarrassed. And I even tried like shading with eyeshadow in photo shoots, so you couldn't really tell. But it made me feel really conscious, and I didn't like the feeling, and it was affecting me. And Dr. Tess told me about this PRP treatment, which is like platelet-rich plasma. from my blood, and then she injected it into these areas and a few other places that typically start to thin for women. Again, like taking care of it before it gets really
Totally.
bad. And I started to notice little baby hairs coming in.
And even your mom noticed,
And
remember?
yeah, I actually haven't told anything to my mom. I didn't say anything. And then one day she goes, "Your hair looks really thick. What are you doing?" I'm like, "Oh my gosh, it's working."
Yes,
So
yes.
I'm
Mhm.
really happy. It really affects your mood
Absolutely.
to be able to be confident about something like your hairline, and feel it's a sign of vitality, right? To
Totally.
have thick, beautiful. I mean, gosh, look at Dr. Tash. Look at you.
People ask me all the time, do you ever, you have really gorgeous hair and that you're perimenopausal, and I've had PRP treatments because I'm not going to wait until the hair is gone. I'm not going to wait until I'm wrinkly, saggy. I'm not going to wait till it hurts down there. So it's like there are ways to prevent it. Yeah. Okay, so thank you all. Lana, you have final thoughts, final words to our audience. Thank you. We had an incredible, huge group of people join us.
Yes. Oh my goodness. I thought this was fantastic. I loved it. I love the philosophy that you have. And I love that what even your patient is saying. Start early. And this is a treatment. The Carboxy is really is the latest, most innovative treatment in skin health. And you can get it from Dr. Tess. It's a beautiful way to keep your skin healthy and hydrated and bouncy like a baby's bottom. And you can use it.
If she walked around, she can say she's like a freshman in college,
Yeah, I find some
and certainly for the neck.
There's a certain kind of endorphin boost whenever you get those compliments.
Yes.
I mean, when I got carded, my day was made. That was the best thing about my anniversary.
Yes. Exactly. And the V is certainly going.
I had some young influencer type DM me, "How old are you?" I'm like, oh my gosh, it's working too well.
We'll take it. So guys, I just want to say thank you to Lana. Thank you, Krista. Thank you to Team M Beauty, Lisa, Angela, my husband, Dr. James, and Nico, and Val. Please, if you're new to our practice, we offer free consultations because what we want to do is talk to you about your concerns and educate you. I hope you all found that this event was educational, empowering, and gives you hope. Those of you who are Krista's age, in any age, right? That you really can look and feel your best at any age. So contact us, email us, call us for your free consultations with my consultants. If you want me to personally talk to you and evaluate you, there's a $250 hold fee that goes towards your treatment.
And if I can add, I think there's so much to say about the people that you're doing this type of intimate work with. And when you get to be with people who are so optimistic and so supportive and so genuine, that really adds to the experience. And it makes this self-care process truly enjoyable, and not just treating yourself on the outside, but really an experience from the inside. I really go home feeling empowered and beautiful inside out, and so positive and happy. And it really is self-care on so many levels, and makes a huge difference with the right people. And this is an incredible family. I'm so in love with them. They are extended family to me, and I think any interaction with them is such a blessing to anyone. So I hope you all have the opportunity.
That's sweet. We have that recorded, so you guys will see that on all of our social media. That will be replayed everywhere.
My face looking like a baby bottom.
Baby bottom. Oh my goodness. Well, ladies, it has been a pleasure. Thank you so very much for having me on your platform tonight. It was amazing, and enjoy your skin, and I'll hope to see you guys soon.
Yes. Take care, Lana. Thank you.
Yes. Bye-bye. Bye-bye, everyone. You have an awesome office. Bye-bye, guys. Bye-bye.
Bye.